Hi, this is Vicky, a nursing student here at Vincent University Jasper, and I'm currently studying microbiology, and this is one of my project for the class, and my topic is about tuberculosis, and I chose this topic because I tested positive for TB infection, and I'll explain later how it happened. Tuberculosis, according to CDC, infects around 2 billion people around the world, but 90 to 95% of them doesn't know that they have the infection. It is because their immune system can fight off the disease. This infection can remain latent or sleep for a long period of time, but when their immune system becomes compromised, it can become active and become very contagious. Mycobacterium tuberculosis on the microscope has a waxy cell wall composed of mycolic acid. It's hardy, which can help this bacteria to resist weak disinfectants, and it can survive on dry surfaces for a long period of time, and that's how it looks like on the microscope using acid fast or Ziehl-Neelsen stain, and this is one of the example of it. Mycobacterium tuberculosis goes down through the airborne route. It goes down to the lower lobes of the lungs, to the alveolar or the alveoli, and the alveolar microphage tries to fight off this disease by phagosomes and lysosomes, but this bacteria is so tricky that instead of dying from this macrophages action, it creates protein that helps it to survive and multiply. Some has flu-like symptoms, and within 3 weeks of this infection, the cell-mediated immunity tries to fight off this disease by using the granuloma, which wall off the bacteria or covers it, but this bacteria is so strong that instead of dying, it cavitates the alveoli and causes caseous necrosis. It also can go up to the hilar lymph node through the gun focus, through this lymph action or through the lymph. It can create this gun complex, which is consists of subpleural membrane in the lower lobes, and it helps it to go up to the upper lobes of the lungs, and this is a representation of an X-ray sample of the cavity or this scar tissue that's made by the infection, and this is called the Ranke complex. When immune system is compromised, as what I said, it goes up to the upper lobes. The memory T cells release cytokines. However, this causes more caseous necrosis and cavitation, and this infection disseminates and spread throughout the lungs, which can cause bronchopneumonia, and it also can spread to the vascular system, which causes systemic miliary TB. Testing for TB includes PPD or the skin test, the large induration means that a person is positive for tuberculosis, and the Another testing is the IGRA, or the interferon gamma release assay. This is true blood. One advantage of this is you don't have to go back for rechecking like the PPD, and this testing is more specific to TB. And the BCG, the person who has BCG vaccine is unlikely to be positive for TB using the IGRA testing. And this is what I have, because this is what my case was, because BCG is a vaccine to help contain the disease. This is the immunity that's the vaccine that is taken by some people around the world. And I had BCG vaccine, which I took from the Philippines. That's why whenever I had my PPD test before I started working here at the United States, I tested positive, but undergone IGRA, and I've had my X-ray, and I tested negative, thanks God. And whenever a person tested positive for PPD or IGRA, an X-ray needs to be done to really confirm if the person has TB infection. And if a person has tested positive for this infection, or before I go there, whenever a person has symptoms, or a patient has symptoms like fever, night sweats, weight loss, or cough up blood, which is called hemoptysis, a patient needs to have this culture, sputum, or the bronchial lavage from the lungs, which is sent to the lab for staining and culture and for PCR testing. Okay. Treatment for this infection consists of, when it's latent, is a single drug for long time, which is the isoniazid. And for active infection, the treatment is combination of isoniazid, rifampin, ethambutol, and pyrazinamide. And the person needs to be negative for a few weeks before they are considered non-infectious. And if an adult has reactivated TB, which they are the most infectious, and they need to be in a negative pressure room, and visitors need to be wearing the N95 mask, including the staff. The visitors and the staff at the hospital needs to wear this N95 mask. One concern about this infection is the drug-resistant strains, which are the MDR and the XDR, which are hard to treat using these usual antibiotics. And for effective treatment, the persons involved should make sure that the drugs work against a specific strain, and multiple medications are used together, and that the medications are used for the entire course of the therapy. And according to FDA, there's a breakthrough medication for this extreme drug resistant strain, which is the combination of the pretonamide or the pretomanid, the bedaquiline, and the linocilid, which is 90 effective for this extreme strains. To summarize, tuberculosis mainly affects or infects the lungs, and it's caused by Mycobacterium tuberculosis. Within 3 weeks of the primary infection, the granuloma tries to wall off or covers this disease, but the caseous necrosis, of course, which create the gone focus, which then can turn to gone complex. And when the immune system is compromised by age or by aging, it can cause the both sides of the upper lobes of the lungs to cavitize or form cavities, which can cause bronchopneumonia, and can also go to the vascular system, which can cause systemic miliary TB. Testing for TB includes PPD, IGRA, chest X-ray, and chest X-ray. And if a person has symptoms like fever, night sweats, weight loss, and hemoptysis, or the bloody sputum, sputum is collected and sent to the lab for PCR testing. Combinations of the treatment for this infection includes combinations of antibiotics for several months, and for the resistant, the multi-drug resistant TB and the extreme drug resistant, consists of special regimens of antibiotics. And these are all my references for this report. It came from CDC, FDA, and the osmosis.org. Thank you for listening, and God bless you.